Welcome to all of you, and thank you all for being here today. So I will be moderating today's session. My name is Anna Larsen. I'm a law student. I'm studying a master's degree in humanitarian and international health law at the University of Montpellier in France. So right now I'm doing my graduation's internship at RWAMREC, which is a part of the Men Engage Alliance. So before we begin, I want to introduce you to today's speakers. So first of all, we have Monsieur Silas Ngaboshia, who is the program manager at Rwanda Men's Resource Center, RWAMREC in Rwanda. And our second speaker is Monsieur Georges Cunyan, who is the national coordinator of Men for Change Network, HOPEM, located in Mozambique. And at last but not least, we have Madame Lucine Zaramba, who is the Executive Director of Communication-Based Sociotherapy, CBS-Rwanda. So this session is a great opportunity for our three organizations to share their experiences and knowledge on ending gender-based violence through transforming masculinities. So in this framework, we have RWAMREC that will be sharing about the Prevention Plus project that aims to transform social norms leading to gender-based violence and how it showed success. We have CBS-Rwanda, who will engage around prisoner reintegration in the post-genocide area and the importance of including men and boys in gender-based violence programs. And finally, we have HOPEM that will share findings on the research conducted on masculinities and attitudes of women and men toward gender equality, reproductive health and rights, care work, and fatherhood. So for this session, our three speakers will each have 25 minutes to share with us all their knowledge and their experiences. So if you guys have any questions or any comments during their presentation, please put them in the chat box, and after each presentation, we will have a few minutes to discuss about them. So if you are all ready, we can start with RWAMREC. So over to you, Silas, for your presentation.
Thank you, Anna. Thank you all. If you may allow me to share my screen. Thank you. So I will be sharing the experience of Under Prevention Plus and the experience of Rwanda. And mainly we will be sharing the key achievements, but also the pathways behind the success of this project. A bit of background first. Prevention Plus has been a 5-year project that has been implemented between 2016 and 2020, and it was funded by the Dutch Ministry of Foreign Affairs through Promundo. And Promundo was not only giving us funds from the ministry, but also it was providing technical support and accompaniment. And this project was implemented in 5 countries, but with this specific experience sharing, we will only focus on the experience of RWAMREC in Rwanda. And it was implemented in Karongi district, all villages and all secondary schools. And if I said one district or Karongi district, maybe I should share also that Rwanda has got 30 districts, so this project was implemented in one of them. And the strategy for implementation of this project has been implementation through existing structures. In the country, we've got so many existing structures, but we have worked through 2 existing structures and as we will elaborate a little bit more. The overall objective of the project has been to contribute to creating a gender-just society by transforming harmful social norms that have been revealed to drive GBV, and ensuring that these changes are rooted in a local system that supports them. So this was commonly known as institutionalization.
Silas, can you just put, sorry to interrupt, can you put the presentation in full screen so we can see it better?
So did I? I think I did now.
Perfect, thank you.
Yes. Now, unfortunately, I can't change the slides if I put a full screen. So.
Oh, okay. So just put it back the way it was.
Okay. The results areas. This project has been implemented following a socio-ecological model, which is we were aiming at results at individual level, community level, institutional level, but also government level. At individual level, we, as maybe I previously said, we're targeting 2 existing structures. At individual level, we were targeting working with young people in the schools through the model that we have of Youth for Change, but also working with couples through the Parents' Evening Dialogue Forums. So 2 existing structures or government structures were targeted. At community level, using those already targeted at individual level, we have conducted sensitization campaigns through International Women's Day, International Men's Day, 16 Days of Activism, and National Teenage Pregnancy Campaigns. But also with the schools, we were targeting inter-school competitions in all secondary schools, but the schools had also to invite the surrounding population. At institutional level, we worked with institutions through capacity building using the Program P. Program P is a model that has been developed by Promondo and that we adapted to the local context. But also we were using the gender transformative approach to train different institutions such as media houses, civil society organizations at both central and decentralized level, and faith-based organizations also at both central and decentralized level. At the government level, we have worked on advocacy for the integration of gender transformative approach in policies such as the National Strategy of Transformation 1, NST1, the sector strategic policies, the district development strategies, etc. Let's elaborate a bit. At individual level, so we worked with couples through Parents' Evening Dialogue Forum. This is a recognized structure, a national recognized structure that was put in place especially to discuss issues in a given village with a special focus on GBV prevention. So at individual level, we have been able to reach 3,759 members of Parents' Evening Dialogue Forum, and we train them, coach them continually. I mean, They receive the training and the refresher training, but with a continuous coaching. 16,110 couples composed of 32,220 individuals attended regular meetings at village level or parents' evening dialogue. So parents' evening dialogue actually happens at a village level. A village being the lower administrative entity, generally composed of 50 households. 122,131 men and women participated in continuous discussions, while the reporting tools also have been distributed at each household level in each village, meaning that each household received reporting tools, but also tools that supported them in doing performance contracts. Performance contracts, this is what comes when households decide to opt for dialogues and having healthy relationships, and then do a kind of planning of the year, what they will achieve in the year and how they will achieve it. We have also worked with young people in schools, where all schools in Karongi district have been reached 63 secondary schools and 1 higher learning institutions that is located in that district. And Youth for Change clubs have been created, trained, but also supported, so they to cascade the achievements of their trainings to the rest of the schools, but also to the surrounding environment. At community level, as I said, based on those individuals that have been trained, that have been receiving continuous coaching, they also led activities in the community, whereby 634,000 of people have been reached by the community campaigns on GBV prevention, 1,000 community role models from the National Women Council. Those are other structures. National Women Council Evening Dialogue, Friends of Family have been engaged in promoting gender and GBV prevention in their respective communities. 6,000 people attended anti-GBV campaigns, such as during the celebration of International Women's Day, International Men's Day, GBV teenage pregnancy, mobile clinics. At the level of institution now, 5,235 government and CSO staff in relevant sectors have been trained on gender transformative approach. 160 religious leaders and youth religious representatives trained on gender and GBV prevention, while 22 media institutions have been trained also on gender transformative approach, but with a special focus on a gender sensitive media coverage and reporting. There has been also establishment of anti-GBV network plan, implement and monitor GBV activities across the district. At the government level, there has been an assessment of the national gender policy and the national policy on against GBV commitments toward GTA in NST1 and the sector strategic policies and DDS. This means that the policies were there, but the assessment aimed at looking at how those sector policies and national NST1 are reflecting the provisions in the policies. And then an accompaniment on those sector policies to embrace the existing policies, gender policy and national gender policy against GBV have been also conducted. There was also an integration of There was also an integration of gender transformative and male engagement approaches in the revised national gender policy that was ongoing, that was under review. Let's then share the key realized results. So it was a 5-year project, so I will just go through the summary of the key realized results. So, and these have been provided by different evaluations, continuous monitoring, but also external evaluations. So there has been an increased understanding of men working with their wives as partners. And there has been reduced domestic violence between couples, increased self-confidence among women and girls, equitable participation of men and women in household decision-making on property use and management, and improved family dialogues and concentration on family development, and also improve the living conditions of families. So if I may go through the quotes describing the above. The first one, I felt that I was myself as a great chief of household and the family property was mine. I now value my wife. We sit down and talk about household development. This shows that it is not only me who has power on household property, but also my wife has. This has helped me in my household. Therefore, this has brought peace. This is one of the men speaking about the change has gone through. So the great change is that in our village, there are no longer problems of domestic violence. And even other common crimes are no longer seen here. It is the reason why we are a model village in our sector. This is one of the ways. There was also some, if I may say, unintended results. Example of gender equitable attitudes and behaviors over household decision-making and property that led to family development. So like linking other sectors of life to the change, how the change can contribute to the development of other areas in the family. There was also positive change of attitudes and behavior. Men take care of children. So caring for children, involvement of men. Men do not have shame. So there has been equitable redistribution of unpaid care and domestic work, and men doing it as a responsibility and not supporting their wives. So there has also the working together between men and women, and that has also revealed to bring happiness in the whole family. This is the model of parents evening dialogue that has been used. First of all, we started by authority engagement. And then we provided the capacities. And from that, they worked on the commitments. So performance contract, just it's just practicing it in their daily lives, planning for the family and implementing that planning while collaborating. So there has also regular meetings and discussion sessions at parent evening dialogue level. So I mean discussions at enforcing the above described. And then there has been regular evaluation sessions that were mainly done jointly with parents evening dialogue committees, local authorities, and RWAMREC. And why authorities were involved? For that institutionalization. The key realized results then with the structure of schools and the Boys for Change, the Youth for Change model. So there has been peer education on positive masculinities and femininities at school and home. I mean, this is happened after the boys, the Youth for Change have been created and then given skills, and then this is a cascade, a model. And boys then undertook that spirit of performing those tasks, activities, traditional, believed to be reserved to girls, such as cooking, cleaning their houses and schools, and enjoy them. So they benefit out of it. So there has been also an increased self-confidence at school and school performance among girls, and even orientation to subjects that were believed to be for boys. There has been also creation of saving groups for self-reliance and economic independence among girls and boys. Schools are becoming full of gender-based violence, so they have become they became free of gender-based violence and mutual respect between boys and girls, but also other partnerships than just sexual. And there has also been reduced early pregnancies among teenagers. If I may go through the quotes again, although I know that I'm running out of time. My dad uses to beat mom all the time when he comes back evening. I used to live in critical conditions. Today, I'm proud to tell you that I sensitize my parents, especially dad. Currently, both are very happy, love each other, share responsibilities. We, as children, getting benefits from that. The family is now peaceful, and two brothers are very excited to help me with household work. When I joined Youth for Change, I first doubted if boys will change. After 2 months, I saw boys cleaning, working with us in everything. No more specific work for girls or boys. We need this to be a reality back home in our community, not only at school. So for peer education, you can see an example, not only at school, but also in the surrounding community, economic independence, rearing pigs and other domestic animals. So, and jointly performing tasks that were believed to be for boys or for girls. So this is the model. This is the previous last slide. This is the model. And for Youth for Change, the first phase has been to engage with schools and having meeting with school leadership, selecting and forming Youth for Change, training of trainers, students and mentors, because it has to be also teachers, among teachers and even parents, committees have to be engaged. And then after the training, regular sessions once a week have been taking place, and using the youth-friendly models like sketch, poems, drama, and then regular evaluations again were conducted by both school administration, not only school leaders, individual school leaders, but school leadership at district level, and then RWAMREC was coming in, providing technical support. Thank you very much. And in Kinyarwanda, we say murakoze cyane.
Thank you, Silas, for presenting this very interesting project. So that was implemented within structures of different countries. Its objective was to contribute to create a gender-just society by transforming harmful social norms that drive gender-based violence. So, as you all heard, this project was quite successful as it had an impact on different levels. It had impact on individual level, on community level, institutional level, and governmental level. So, as we saw in the testimonies, couples showed more communication, less domestic violence, equal participation in the household, and there were also quite some changes among young people. Boys started to change their behaviors towards girls and participating in activities that were traditionally reserved for girls. And this also helped to increase self-confidence among girls, as you explained. Thank you very much, Silas. So in the question, we have a question from Sandrine for you, Silas. So the question is, what is the role of the people in their community who have been trained, and how do you monitor and follow up their impact in their communities? Over to you, Silas.
Okay. As I shared, this was a project that was targeting one district, all villages. I mean, all the whole district till the village level. And on the side of schools, each secondary schools in the community, including what we commonly call 9 or 12-year basic education. So the role of the communities, yes, and as I said, the project worked through and with existing structures, meaning that those structures have already that mandate, and the project was just supporting technically. So the role of the community has been, I mean, the leaders, like the committees of the parents' evening dialogue forums, has been to daily support that journey of change, if I may call it so. And the district, the monitoring tools have been developed together with different institutions at different level. So to monitor on a daily basis if that change is really on track. So from the village leader, cell, and sector till the district level, at each level, monitoring tools adapted to what each level is supposed to be monitoring have been developed, and once a month that monitoring was conducted. So concerning the evaluation of impact, yes, we have been tracking together again, together with the district's authorities till the village level, tracking the progress, and then towards the end of the project, especially the last year of the project, the 5th year of the project, we proceeded to the weaning. I mean, transferring all those responsibilities, monitoring responsibilities to the district authorities, again at a different level, through what we commonly call institutionalization. So I would share that this project has been very impactful, and as we have been working with those institutions, existing structures having that mandate already, the project phased out in December, but activities are still ongoing because the district has taken everything in hands.
Thank you, Silas. So maybe we have just a couple of more minutes for another question from Diane, she has a question related to change in attitudes and social norms. So what is your take about men that denies their spouses to get loans from any economic activity? For example, if man needs a loan, he just informs his wife and the wife signs or consents that, but when it comes to wife who needs a loan, the man hesitates to sign. And this has been a cause of
Thank you, Diane. Yes, thank you, Diane. I think this issue and many others were among the toxic social norms this project was targeting. And lucky enough, this project has a unique niche of tackling those toxic masculine behaviors and practices. I mean, tackling those negative social norms on masculinity. So I would say that even evaluations have revealed that all these practices have reduced at the household level, and that change, as I said, is even sustained by local authorities, religious leaders, but media, but also those private sectors. I shared about the joint action development forums where in different actors in the districts, including even civil society and faith-based organizations intervening in that district, where they have been trained and refreshed so that they can accompany this change process so that even in their own interventions, they can mainstream this aspect of addressing those negative social norms that are hindering the development of the household. So if the decision making is now equitable, if dialogue is instituted in the families, if people are now planning together, wife, husband, including children, this means that even this practice has been addressed, and the planning or family performance contracts is also accompanied by different people so that it can be a gender-aware planning and where everyone, a gender-aware, a gender-equitable, where men and women and even children can have a take into that.
Thank you, Silas, and thank you, Diane, for the question. So now I would like to go further in this session and hand the presentation to George, who is from Men for Change Network in Mozambique. So George, if you're ready, the floor is yours.
Thank you, Anna. Allow me to show my presentation. So can you all see my presentation?
Yes, we can.
Oh, okay. So okay, thank you. So first of all, I'd like to apologize for my camera is not working properly, so you cannot see me very well. And secondly, well, I'd like to say that today I tested positive to COVID. Well, I received my test of COVID and it's positive. So the first reaction was a shock. I hope it doesn't interfere in my presentation. But I'm feeling well with a little bit headache. I think that it will pass. So I'm going to share with you our to address gender-based violence. So my presentation outline will, in the first period, I will speak about the background. And secondly, the research on the construction of masculinity. And we'll present the research findings. And in the second moment, I'll speak to you about the pilot intervention addressing violence against women. And then the results of change, some examples of change and lessons learned. And finally, the challenges ahead. So Mozambique has made a progress in strengthening its legal and political environment to reduce gender inequality and violence against women and girls. However, we feel that there's still a gap. We still have to work on integrating men and boys in the policies and the legal framework. As HOPEM, we're addressing harmful social norms in order to achieve gender equitable relationships, in particular at household level, to eliminate violence against women and girls through male engagement. So we'll share our experience in two perspectives. First of all, the research findings, and secondly, our intervention experience in the same area that the research was done. So in the research perspective, to ensure an evidence-based intervention, HOPEM in partnership with Rwanda and Mozambique University conducted in 2019 a research on construction of masculinities in southern Mozambique. This research aimed at understanding the construction process and experiences of masculinities, their impacts on the daily lives of men and women, and the way individuals and communities react to ideas of equal rights between men and women. So we had two main research questions that lead this research. The first one is what are the predominant conceptions of masculinities and how they expressed? What are the attitudes of women and men towards gender equality, violence, reproductive health and rights, care work, and fatherhood. So to answer this question, we use the qualitative and quantitative methodology, and we found that 81% of participants disagree that to be a real man, guys need to be aggressive and rude. 89% of participants totally disagree with the use of violence, particularly against women. 65% of respondents agree with the idea that women's most important role is to cook and take care of the home. 36% of participants agree that decisions on the household income should be taken by the couple, against 35% who think those decisions should be taken by men. 67% of respondents affirmed that they are not currently using any family planning method. So with these findings, we noted the persistence of a traditional masculinity. However, there are trends of change or life change. So this is the first part of our presentation, and the second part is to do with a pilot project that we implemented in 2000 after the research, addressing masculinities to reduce violence against women and girls. So this was done in partnership with High Commission of Canada in Maputo. The project aimed at enhancing violence-free living conditions for women and girls in Marakwene and Masinga districts, to improve male social behaviors and practices that strongly contribute to reduce violence against women and girls, transforming rigid gender norms by combining different approaches to community mobilization, including group discussion of men and boys in the community networks. 90 community leaders from Masinga and Marakwene districts in the southern Mozambique, of the total 240 trained by the project, reported reduced cases of violence in their communities, and publicly oppose violence against women and girls. They share also the domestic task and exercise more responsible parenting. Also, 9 networks were established and in both sides of the project. So these networks are composed by community leaders. Each network has almost 20 community leaders, and they do monitoring, follow-up cases of violence against women and girls. And also they share their experiences relating to this issue, and also their regular training on several issues related to human rights and gender issues. So using an integrated mechanism to report violence against women and girl cases was established, and the police, the courts, hospitals, they are connected to follow up cases of violence against women and girls. 35% of men and boys who participated in the reflective groups report using peaceful methods to address challenges and conflicts in relationships. 960 community members, including women and leaders, directly targeted by the project, reported using a referential mechanism to report cases of violence against women and girls. The project produced and disseminated 440 videos featuring positive masculinity models under the key motto, "This is being a man too." So this activity consisted of the activists who gave a testimony of having changed their behavior after our intervention. We asked them to make a short video showing what exactly they do at households, and we disseminated it through media, through WhatsApp and Facebook. So inviting other men to follow the example. So we did this during when we had this COVID pandemic, as to sensitize men since they have to stay at home. What should they do at home? So this was the main main objective of the videos. So we have got two examples of. I'm going to share some examples of changes. This is Mr. Xavier. He's one of the community leader in Masinga district, one of the site of the intervention. He reported to have changed his behavior, and we asked him how was it. He said that before our intervention, he has a neighbor who used to beat her wife. But after the intervention of our intervention, he decided to report this case to the police, and the guy was taken to court and was condemned for this. So he was not happy because the sentence, the penalty was insignificant for him. But what was interesting was that he never had more complaints of the wife, the neighbor, of this aggressiveness behavior. Or from there, after that, there was peace at that neighborhood. So this was the interesting thing for this community leader. And this is Mr. Armindo is also a community leader, and also he gave a testimony of having changed his behavior, and we asked him to bring the wife so that we could understand from the wife what does it mean. And the wife said that yes, he used to be aggressive man, but since he started with these meetings to discuss the violence issue, I saw some change. But before, I didn't believe in him because I thought that he was lying. He was going out for drinking or staying with other women. But I started to see some changes in his behavior. There is no more violence at home, and now being interested in what he's doing, I also do it with him. We sensitize the community, and we refer cases to the police and so on. So we also found this interesting, that at least there's a testimony of changing, and there is peace at this family. So there are many lessons of this intervention. I will share with you 3 main lessons. Consistent and comprehensive community mobilization is fundamental to address the root causes of gender inequality. And engaging men in challenging, in transforming social norms, we found it to contribute better for understanding and construction of, or deconstruction of toxic masculinities. And also participation of multiple stakeholders, as we said before, the police, the hospitals, they work all together, connected. It make the transformation easy. However, there are challenges. And we'd like to share 3 main challenges. And the first one, we ask up to what extent we can monitor and evaluate the changes and how to generalize the degree of behavior change in the community. We found this challenging. We are aware that this is challenging for many interventions, and we think that it's very important always when we do have opportunity to discuss, good practices on doing monitoring, so that we can have almost the big picture of what we've been influencing for changing. And the COVID-19 pandemic also is challenging because it may be exacerbating structural inequalities at large, and the violence against women and girls in particular, that was not taken into account in the project design. Public service and the community resource to support survivors in the context of slow and delayed justice. So the other challenge has to do with the slow, delayed justice. So our activists, sometimes they are demotivated because they refer cases, but then the justice system does not respond. So this is the main challenge that we have, because it demotivates our activists to work to change the mentality. So this picture at the end, it comes to summarize the 2 parts of this presentation. This is a transformation process that goes upwards in the under. We can see that there are so many people, but upstairs there we see some few people. The sun shows represents the knowledge, represents the knowledge of equal rights, gender equality. So those people over there up, they are free, They are the results of our intervention, and there are many people under, which shows that we still have a lot to do, but there's something changing. There are people willing to change. However, there are some challenges. So this is the experience that we have to share with you, and we expect your intervention to, especially to help us thinking about the challenges that we've shared here. And thank you. Muito obrigado. Thank you. Merci beaucoup.
Thank you, George, for this presentation, and thank you for I like the last picture. It was a good way to illustrate all these problems and challenges you face. So this presentation of your study involved over 1,500 participants about masculinities, men and women's attitudes toward gender equality and violence in Mozambique. So it showed us really that traditions are still a break to gender equality, even if mindsets are starting to change thanks to successful programs like the one you just presented to us. And in this case, this really shows that one of the key tools to work on this is the community mobilization. But as we all know, such big changes takes lots of time. Ending gender-based violence and promoting positive masculinities is not an event, but it's a journey. So thank you, George, for your presentation. I don't see any questions right now in the chat box, but we still have lots of time. So I suggest that now we can listen to Lucy, and then if anyone has any question or comment about George's presentation, just put it on the chat box and we'll come back to it later. So over to you, Lucy, and thank you, George.
Thank you, thank you.
Hello, everyone. Thank you, Anna, for giving me a floor. I'm Rusinza Ramba. I'm Executive Director of Community-Based Social Therapy in Rwanda. I'm going to take you through the experience we have in reintegration of genocide prisoners and also explain how it is a gendered affair. Through my presentation, I will focus on long-term effect of genocide and imprisonment, and also some related gender issues. And I will explain responses for prisoner reintegration and the contribution of social therapy in that. And I will finish by sharing with you the barriers we meet for successful reintegration, and I will conclude and also give some recommendations. As I introduce my presentation, I have to remind you that Rwanda is a nation which emerged from the horrors of genocide and political violence that claimed more than 1 million lives and left the country's social fabric shattered and the national economy in ruins. Women as well as men have been affected by genocide. In that period, you could see countless victims with deep wounds needing to be healed, but also a large number of perpetrators to be held accountable for justice. CBS, again, was initiated in that time just to contribute to the psychological well-being of those people who were affected by genocide, to restore the social fabric, but also building the peace at grassroots level. So for more info for CBS-Rwanda, you can visit our website as you see it on the screen. Oh. Don't know what happened. Let me, okay. Yes, as I said, with many people who were involved in genocide, as the justice was a key pillar to achieve the minimum level of fairness and security, many genocide suspects were put in prison. And this leads to a number of gender issues, among other effects of genocide and imprisonment, and this hindered the successful reintegration of genocide prisoners. Our country has put several mechanisms to address those issues, including Gachacha. I think most of you have heard about this traditional mechanisms where people were trying to solve themselves what happened, and also TIGE, which is in French, Travaux d'intérêt général, or public works for general interest. But on the other side, peace actors like civil society organizations have initiated community-based approaches like social therapy to reestablish the restorative justice. I can here focus more on the effect of genocide and imprisonment. But before that, allow me to remind you about the particularities of genocide against the Tutsi in Rwanda. And this will make you understand how the reintegration process was more complicated if you compare with other genocide that happened elsewhere in the world. The genocide against Tutsi in Rwanda was really a meticulous organization. It was supported by the former government, the media was involved, the military was involved. It was done in an artisanal way where traditional weapons were used. It was the quickest genocide, but I have to emphasize on this characteristic, which is popular genocide. Because if you compare with other genocide, you could see that the military were involved and the political people were involved in those genocides. But in Rwanda, citizens, neighbors were killing other neighbors. And it was done in an intimate environment where even a husband could kill a wife, a husband or a parent could kill their children. So these popular characteristics makes complicated the issue of gender, but also the issue of reintegration, because people have to return back into their community where they committed those genocide crime. Another characteristic is that the genocide against the Tutsi was done by Rwandans, but also arrested by Rwandans, which means that the solutions are in our hands. We need to deal with all those gender issues related to the genocide and imprisonment, but also see how we can contribute to the reintegration of ex-genocide perpetrators. So among many effects of genocide, I can highlight, but not limited, there is a loss of initial social identity. So for a man who committed the genocide, for example, if he was considered as a role model in society, he can't be perceived as before. He lost that social consideration, and people can't really consider him and give him a value like before when they go back to the community. Another effect, it's a risk of radicalization. We have seen that people who spend more time in prison, the prison becomes like their normal life. And when they go back, they take the prison to their home. Let me give you a short example. Like an ex-prisoner, when they come back to their community, they can stay in a corner in their house waiting for an order from someone. A man can't take any initiative from their house because he has been used to be given a briefing from the prison, and other cultures that they have adopted being in prison, they take them back into their houses. And this really affects the issue of gender balance and complicates the reintegration process. Another effect is bad image and stigma. Those who committed genocide, when they go back to the community, they are still called genocidaire. They label them like internal criminals. Even if they served their sentence and they have finished their sentence and they go back to the community can't see them as those who finished their sentence. They still consider them as criminals. And in this area, young people used to ask us, what is the name that we can give to those ex-genocide prisoners? And the response, maybe we will also contribute to name those people. We used to tell them that they will find themselves a name. The more they will adopt positive behavior and positive masculinity, maybe the society will name them again and remove that labeling of genocide perpetrators. Another effect is that due to the wrong imprisonment, we have seen that they reproduce criminality. When some of them, though the imprisonment serves to deterrence, served to the eradication of culture of impunity and corrective approaches, but some of reproduce of really achieving or adopting good behaviors. Another effect is the intergenerational trauma. We have seen that what the parents went through are being transmitted to their children. A recent research by Rwanda has shown that 27.9% of survivors suffered from trauma, but among them, 18.5% are within the age of young people, just people who didn't experience genocide or who were very young during the genocide are now manifesting the signs of trauma. So it is due to that transmission of trauma from parents to their children. There is also a big issue of identity. So in Rwanda, the research has shown that between 2,000 and 3,000 women were raped, and there are around 5,000 of children who were born from that rape. Those children, they are facing a problem of identity. They don't know their father, but also they are not accepted by their mothers. But on the other side, the descendants of genocide perpetrators are having that issue of identity. They can't really accept that their parents did such crimes, and they can't even identify themselves as a son of a killer. So that's a big shame for them, and they face that issue of identity. There is also a traumatized motherhood. As I said, women who were raped, they have an ability to provide physical and emotional care. And also there is lack of intergenerational dialogue. Ex-prisoners can't really reveal to their children of what happened. They can't accept that, and children are being confused, and this develop a conspiracy theory. If I can talk about how this effect of wrong imprisonment also leads to gender issues, I can say that, as you all know, in many cases, genocide or killing is a fact, a highly gendered activity. Because in most cases, the genocide is done by men, and also men and boys are those who targeted more than women. But on the other side, you could see that during genocide, violence directed at women and girls is fed by existing gender attitudes in society. And I can say that as men in Rwanda were put in prison, This prompted women into the traditional male reserved roles for which they were not prepared to. Here in Rwanda, I have to say that a big number of those who committed genocide were men. And the research has shown that only 4.7% were women who were involved in genocide. But few of them committed killings, but others were, let's say, involved in other things like showing where people were hidden and so on and so on. But most of genocide criminals were women. And when they were put in prison, the women were staying in the community and adopt other men roles of which they were not used to do. They became heads of families. Everything was on their shoulder, and it was really a big issue for the society. Another point is that due to that shift in gender roles, it has led to the violent behavior against female partners, because when the ex-prisoners came back to their families, they find women being remarried with other husbands, having children, but also they have been economically empowered. So they are no longer dependent to their former husband, let's say, and this develop violent behavior on the side of those ex-prisoners because they are no longer considered like their husband. And also, we have seen that in prison, when they are still in prison, they are taught about different programs and changes in society, among which they were explained about the gender policy in Rwanda. Though they were informed about that, but they don't accept it. They perceive it as a policy that is too harsh towards them as men, and does overprotect women. And this is resulting in making them struggling in managing a household together with their wife and children. As I said earlier, they lost so-called manhood. In nature, a man is a man provider, a man protector. But when an ex-prisoner comes back home, he is powerless. He doesn't have something to deliver. And as a consequence, the family members, both wives and children, don't value him, and this results in a negative masculinity. And also, we have seen that there is a behavior change regarding sexual relations. Some ex-prisoners adopted homosexual behavior, and they use power without mutual consent with their wives. That's really a big issue, and it leads to divorce and other conflict at family level, and there is an increase of gender-based violence. And we have seen that it requires a lot of adaptation of male identities just for helping an ex-prisoner to become again a man provider, a man protector, but the issue remains that they are still poor. As responses to those issues, I'm going to share with you the experience of social therapy. But before that, I have to say that the government of Rwanda has initiated various social protection programs that are benefited by ex-prisoners as well as other people, like work opportunities, psychosocial support, education, and vocational training courses. CBS, among other peace actors, focuses much on psychosocial support. What we do is that we involve ex-genocide prisoners together with their respective families, their community members and leaders, and creates a safe environment with equal treatment. So the people meet in a group, in a safe space, being with genocide survivors and other family members, and they try to identify their problems, share ideas, but look together for solutions. As an example, last year, we were in COVID, in CBS, we managed to invite 1,419 ex-prisoners and their families, because we work in a community. When they are back, we invited them, but we also prepare them being in prison. When they are about to be released, our intervention work there to help them to prepare accordingly. And we managed to invite in our social therapy groups 535 prisoners. As an outcome, we have seen that through social therapy sessions, ex-prisoners regained social dignity, live in harmony with their families, and promoted positive masculinity among them. Here I have few testimonies just to show you how social therapy contributed much in increasing social dignity, but also peace building and reconciliation. One of the ex-prisoner testifies that I offended people during genocide, and I was imprisoned for 10 years and later went for TISH. When I was in prison, I could not feel as if I'm a human being. I was completely isolated myself from others. Before the court, I recognized my role and apologized. But when I was in prison, I felt that I was not forgiven. When I got released, I never wished to come across the families I offended. I was very fearful and could easily fall down whenever they looked at me. A few months ago, people came to invite me in social therapy. When I came, I met the person I had offended in a group. The more we met, the more open I became. We interacted and the fear has disappeared. That's one testimony. Another testimony is to show you how social therapy contributed much in the promotion of positive masculinity among those ex-genocide prisoners. This man was saying that I was imprisoned in 2007 and expect to be released last year. He was still in prison. He was married in 1995 and have 4 children. Before joining social therapy group, I was depressed and ashamed because my wife, children, and all other family members, as well as all my friends, hated me. I had planned to find a place to live far from my village immediately after my release to avoid being stigmatized. Once my wife started to mistrust me, she gave me 5,000 Rwandan francs, telling me to use that during the 50 years of my imprisonment. She told me that she nor our children could ever visit me in prison because I had not told them about my crimes before being imprisoned. I was also anxious about the person whose relatives I had killed. Social therapy session helped me to regain positive emotions and develop a good plan for my life. I now intend to join my family immediately after my release. I now realize that I'm the source of all problems in my family, and also that I severely wounded genocide survivors through my crimes. This is a prisoner who is about to be released. The final testimony is about to show you how social therapy people to adopt male identities. Here is again a man who is saying that before I joined social therapy, I could not socialize with others. I had been in prison for 20 years and I was detained by my wounds. I was conditioned by the prison life, always waiting for command from someone to tell me what to do. I could not lead myself and my family. Now things have changed. The group helped me to realize that I'm no longer in prison. I started reconnecting with others. As I conclude, I can take you through some major gaps in this process of reintegration, though we have seen good result, good outcome in promoting positive masculinity, but there are still changes in gender roles, with some women becoming heads of household, which creates spousal conflict and domestic violence. There is also limited and lack of job opportunities, an issue of accountability between ex-prisoners and community, because most of them don't want to tell the truth where the bodies were hidden, and this makes complicated the reintegration process. There is a pending reparation issue, but also new cultures and behaviors that were developed while they were in prison, including those homosexual behavior, hinder this process of reintegration, and it complicates the promotion of positive masculinity. And also they are still being seen as inhuman, and also in the community there are limited opportunities to prepare the ex-genocide perpetrators before being released. As I conclude, I have to say that successful integration requires a set of programs that have to take into account gender issues, as you have heard from my presentation. For that, an advocacy should be made to policymakers on the development of the integration policy of prisoners, because there is no clear policy for such reintegration. Yeah, the ex-genocide prisoners, they benefit from the existing programs, but there is no specific policy for them. That's why we advocate for that. Again, local leaders should mainstream the reintegration of prisoners in all development plans. And finally, I have to say that community structures could reinforce the establishment of community dialogues, like the approach of community-based social therapy, to prepare the hosting families and community in general. Yeah, thank you very much for your attention. And if you have some questions for us, we would really appreciate to respond to them. Thank you very much for your kind attention.
Thank you, Lucy, for this very interesting presentation about the genocide and the reintegration of prisoners in Rwanda. So, as you said, the consequences of the imprisonment of the genocide perpetrators are very rough. They lose their initial social identity, and we can say that they kind of lose a part of their humanity. They can develop violent behavior and even pass their trauma to their children. So that's why this work is so crucial for the Rwandan society. And it's important to center different services that can help their reintegration. So as you said, this can be done by engaging local leaders to integrate these prisoners, but also by using community-based models, so people can share their painful past and learn to be in harmony with their communities. So yes, as you concluded, it's so important to make an advocacy for their reintegration by using sociotherapy, as your presentation showed that it has very successful results. So thank you again, Lucy, for this presentation. It was very interesting. And I will see in the chat box, there are not any comments yet about your presentation, but I saw a question earlier again from Sandrine. So if Georges is still among us, Sandrine is asking to share how the program came to convince or break the cultural beliefs related to gender roles, and what have been the challenges about that? So about culture, the cultural breaks.
Yeah, thank you, Anna. And thank you, Sandrine, for this question. Really, dealing with the culture issue, it's not easy. And particularly in the South Mozambique, in Manjacas, we've got a community which is very traditional, conservative, and it's not easy to disseminate our message and get the results. We've been facing barriers such as our national law against against violence against women is seen as an instrument that comes to promote divorce in the couples. Because they think that the government is giving more rights to women than men, and the women are not exercising very well their rights, so they don't want to hear about this. But we use the ecological or holistic model in this transformative approach, whereby we target the individual, the community, the institution. And our main strategy is to, when we go to the community, first of all, we work with the leaders, individually the leaders, because the leaders are very respected in the community. And once we sensitize the community leader, then the way is open to disseminate the information. So this is the main strategy, the ecological approach or the holistic approach that we've been using to influence the changes, and it works. So this is what I can share with you, Sandrine, and this challenge. Thank you.
Thank you, Georges. We have another question, maybe for you, Silas, from Debbie. Debbie is asking, in terms of approaches, did you feel that the same approach that you use was effective for different categories of stakeholders, including youth, adults, and community leaders?
Thank you for the question. I would say that RWAMREC has got different models adapted to different categories of people. We used the model, the Youth for Change model, because it has been adapted to the youth. It is adapted to the youth, and actually we departed from the program H&M, again developed by Promundo. Program H is a program specifically designed for a journey of transformation of masculinities, specifically for boys, and the program M is designed for girls. So those programs have been adapted to the local contexts, and those are models that have been tested for quite some years and proven to support people in the journey for transformation. And the program of PED, the model called PED, it is also adapted to parents' evening dialogue forums. We've got so many others, maybe the JOT, Journey of Transformation, designed for engaging men in promoting women's economic empowerment program. We've got Bande Beriho, that engages men in maternal, newborn, and the child health, engaging men in maternal, newborn, and child health. So we've got a number of models that can be shared with some stakeholders. You can reach out to us so that we can discuss. But what I would maybe say in response to this question is that as development partners, we all know that if you have targeted a category of people, you've got to assess which model that can work better. You test it, you implement it, and from experiences of implementing that model, you adapt and adapt until at least you know that this is working better. I've written in the chat box that at the end of the program, this program, we have realized that it is really changing. I've seen someone sharing her experience. She happened to visit Karongi district and our project. So we have realized that it has really impacted on the lives of people and impacted on the working style of the local authorities. So, which is why towards the end of the program, we developed a kind of working pathways or capitalization document. Those pathways have been documented and can be shared with whoever would need this, because it can. We thought it can really inform whoever is likely implementing a similar program. Anna, maybe I can take the opportunity to respond to some other questions that were addressed to me in the chat box.
Sure.
Yes, I've seen someone asking a question. What I can say about this is, again, is sharing our.
Okay, I think we just lost Silas. Silas, are you here?
I had an internet
Oh, okay.
connection cut, yes. So again, on the question of how do we plan to reach a big number of beneficiaries of this program, again, I ought to share our experience. We've realized that it wouldn't work maybe implementing this kind of project or scaling it up to the rest of the districts today or in some years to come. But at least there is something you can do. One is, first of all, using the social ecological model approach of implementation. So working in a district, but reserving some activities that are dedicated to influencing the national level. Because if you influence the policies, the sector, the sector policies, if you work with the media, if you work with other stakeholders at national level, you are likely, the likelihood of having or reaching a big number of people is high through those other stakeholders. So this is how we did. We targeted some stakeholders at district level, all stakeholders into the Joint Action Development Forum. at the national level so that at least they can mainstream gender, GBV prevention, positive masculinities promotion into what they are already doing and how they are doing it. It is what they are doing, how they are doing it. We also targeted the nation stakeholders, national level. We provided them with capacities in gender transformative approach, and some of them have already streamed this into what they are doing and how they are doing it. We also worked with the media, but again, if we have we get the opportunity to get funds, yes, we will be able to scale this up to different to different districts. Another question, if I may, it was a question related to culture. So how do we change the culture? So the culture is a very sensitive thing. And you would see that our culture has set how we define ourselves as men and as women, and how we socialize, how we socialize to become men, become boys, to become women, to become girls. And within this package, there is a set of negative values. Let me use a simple word: negative values. So I do believe the essence of a culture is not to promote negativity or negative values. So what do we do with the gender transformative approach? The aim is to dismantle these elements, socializing our children or defining men and women in a negative way. So this is the first step. The second one is to redefine manhood, redefine what is masculinities, what is it, or what it does mean to be a man, with dismantling those negative aspects. So I do believe this is not, this does not have a negative effect on our culture. It instead enriches it, because we are embracing positive values that are coming into what we already have. We are embracing what is changing, what is negatively affecting us. So, and due to the methodology that we use, because we don't train, we just facilitate people, and through self-reflections into groups, they themselves discover those negative social norms and then decide to change them so that even our culture can be beneficial to us. Thank you.
Thank you, Silas, for these very interesting answers. So now I can see that we have quite some questions for Lucy. And a very interesting one from Fabien, who is asking if you could share the situation of ex-prisoners who returned back in prison because perpetrating gender-based violence against their women.
Yeah, thank you very much for this question. Actually, I have a number of questions related to that. As I said, genocide killing is a gendered activity because it is mostly done by men, and women are facing the sexual violence. They are raped in most cases during genocide. So what happens for us in social therapy, we invite ex-prisoners without knowing what they committed, because we can't really identify them, and even the community can't know what they really did. But when they come into our group, as I said, we build a safe environment where they can build trust and start to share their inner wounds. And when someone comes to be open and reveal that he raped someone, and when someone is even in that group, they can share those emotions and try to seek for forgiveness, and the group members can even advise them to go further, because in social therapy we also have a referral systems. We don't work as an island. When there is issues related to GBV, we can refer them to other existing mechanisms. But what we do is to empower our participants to have that willing, that capacity to regain that safety, to feel safe in mind and to cope with what happened to him or her, and have that power to go further, look for those additional support. So I can say that in some cases, we can refer the GBV cases to one-stop centers, to health centers, just to give them further assistance. We emphasize much on psychological well-being for those people and help them to regain the peaceful mind. Another question that was asked to me is how many prisoners that we reached. I have to say that I have figures for this year, the last year, 2020, but I have my colleagues here who can also complete me. I have said in my presentation that in community, we reached to 1,490 ex-prisoners and their families. In prisons, because we work in different 5 prisons in Rwanda, we reached to a number of 535 prisons. They were all invited in our groups. And another question, which is also very interesting, how do we prepare the receiving community? Social therapy works in different settings. We work in a community, we work in a prison, but also we work in refugee camps. What we do, for this issue of reintegration, we prepare both settings. We go into the prison and we invite prisoners who are about to be released into our social therapy groups, and they go through a journey of 15 weeks, and they try to share and to build trust and to discuss about different things. But in a community, we also organize same social therapy groups where we invite genocide survivors, other community members, ex-prisoners who are released and their families, and they also discuss about the effect of genocide and other current related issues. So the community is being prepared, and the prisoner who is about to be released is also prepared. In a way, when they go back to the community, they found the community being prepared and they accepted them because they also go through to those social therapy groups. Another question that was asked to me is how, a woman who committed genocide, how is she perceived by the community members when she's back to the community, but particularly how is she accepted by her husband? So this is a very interesting question. Through the testimonies that we have collected from the ex-prisoners, women testified that they feel unhuman because they were caregivers, they were supposed to give life, and they contributed to kill people. So they lost that moral spirit of being a human, and they are also stigmatized at a high level compared to the man. And we have seen that even if they were still in prison, you could see that the wives of ex-genocide prisoners used to visit their husband while they were serving for their sentence in prison. But a woman who was in prison, her husband could not visit her in many cases. And when they go back to their families, you can imagine what happens. It's really a rejection. He's no longer considered as a wife, a mother of children. And we have seen that most of them choose to go elsewhere rather than coming back to their community. And what I can see, when they are invited in our groups, we try to take them through social therapy journey. And when they regain that safety, that peace of mind, they try to cope with the painful past they went through, and they try slowly to adapt themselves to that situation. Because I have to say that the genocide is really a crime that you can't see how to punish and also how to forgive. Sometimes we tell them you have to accept of what happened and of how people are treating you. But as those husbands of those women are also invited in our groups, when they are sharing in a group and discuss about what happened, their husband can really reach to a level of acceptance of their women. Finally, it's about homosexuality. How do we help women which were abused by those homosexual behavior that ex-genocide prisoners were developed when they were in prison? So it's a same approach. When, for example, a woman is invited in our group, and when she can reveal about that homosexual abuse, the group members can discuss about that issue and can advise her what to do. But as I said earlier, when the issue is more complicated, we advise them to refer the case to other existing mechanisms, because we collaborate with, as I said, one-stop centers, health centers, and other clinical psychologists who can give further psychological assistance to those women. But we also try to, within the group members can try to advise that husband to change that behavior, though it's really a process. It can't be done like in one day. It's a process. They can change, but if they resist, those people with higher assistance, they can continue to mentor them, and finally they can change the behavior. But in certain cases, not only in social therapy, what we see in our society is that this results in most cases to the divorce, because homosexual behavior can't really change very quickly. Thank you very much. If my colleagues who are here can complete me, just like Diogene, like Chantal, okay, feel free to say something. Thank you.
Thank you, Lucy. So I think we are starting to reach the end of this session. I would like to thank you all three speakers for your very interesting presentations. I hope that these presentations gave a lot of impactful information to you all. Personally, for me, I learned a lot of things. This really encourages us to continue this work of working together towards more positive masculinities, to end gender-based violence. And to summarize this meeting, I think that there is one common thing in just these three presentations. It's the importance of working at the community level and using dialogue, talking, listening, and letting people explain themselves. And all this needs to go through a conversation. It's very important. So I hope you will all participate to make advocacy for changing things like this, using programs like this. This presentation showed that they really have an impact, and they are very successful, as mindsets are beginning to change in Rwanda and Mozambique. So thank you all.